U.S. Health Secretary Robert F. Kennedy Jr. has fired all 17 members of a panel of vaccine experts advising the Centers for Disease Control and Prevention. The move is the most far-reaching in a series of actions by Kennedy to reshape U.S. regulation of vaccines, food, and medicine. Kennedy is a known vaccine skeptic. He has accused the committee of having financial ties to the pharmaceutical industry, but he did not provide any evidence.
For you today to present.
Well, for more, I'm joined by Professor of Preventative Medicine at Vanderbilt University, Dr. William Schaffner. He is in Nashville, Tennessee tonight. Dr. Schaffner, it's good to have you back on the program. When we heard the news that the entire CDC Advisory Committee on Immunization Practices had been fired, we immediately reached out to you. During the coronavirus pandemic, we spoke to you countless times for guidance as vaccines began to be offered to the public. How much of that guidance came from the recommendations of the advisory committee that was just shown the door?
Well, Brent, the recommendations regarding vaccine use as they were first promulgated and then reviewed and revised over time all came from the CDC's Advisory Committee on Immunization Practices. There were endless meetings of the external experts on that committee assessing the data, looking at the details of the vaccine, and then making recommendations about how the vaccine should be used in the U.S. population.
And why is that guidance on immunization practices, why is it so important for public health?
The recommendations of the advisory committee made in conjunction with professional organizations become the standard of practice as to how vaccines are used in the United States. Those recommendations are actually implemented by pediatricians, family doctors, internists, other healthcare providers in the country. And they also are important because our private insurance system keys on those recommendations, and that determines which vaccines and under what circumstances they'll be paid for.
Yeah, which is important, especially in the United States. I know we're talking about a U.S. advisory committee, but the guidance from that committee impacts people all around the world, doesn't it?
Well, the guidance influences what happens around the world. It's not a direct mirror. Different countries have different ideas, but certainly the whole concept of having such an immunization advisory committee has been taken up, and similar committees have been created in other countries around the world that have been constructed, designed in the mirror of the CDC's advisory committee.
So the committee then is like a template or a role model for other healthcare systems around the world. What does the committee's firing mean for public health moving forward?
Well, at the moment, the committee hasn't been replaced, and we wait with some expectation that perhaps the membership will be reestablished with new members before the committee has its next meeting, which is on June 25, 26, and 27. There was a full, indeed packed agenda of issues that were awaiting deliberation and votes. So this is all so precipitous, so tumultuous that we don't know what's going to happen.
I want to let our viewers know, too, you are also medical director of the National Foundation for Infectious Diseases. And I understand in that role, you have been the liaison with the foundation and the CDC's Advisory Committee on Immunization Practices. I mean, you know these people, and these people are medical professionals. They are physicians and they're scientists. Am I correct?
They are indeed. They represent everyone from basic vaccine science to practicing physicians to public health and widespread population-based implementation. It's a rich group of very dedicated people. They get essentially no money for participating, and the work is very arduous and insistent. Everybody signs up for a 4-year tour of duty, and then there's rotations of members. And these committee meetings are open to the public. They're wonderfully transparent, and the committee members must have no conflicts of interest with manufacturers who make vaccines.
Yeah, and that brings me to my next question. What would you say to people who believe that the advisory committee acts as, let's say, a rubber stamp for the pharmaceutical industry? In my long experience with this committee, they are very, very critical, and they make their own decisions. There have been times when vaccines were licensed for essentially the entire population, but the recommendations were much more restrictive because the committee thought that only certain high-risk populations should receive the vaccine. So this is a genuine external advisory committee, and I can assure you, I've been associated with it for many, many years in different ways, and it has been a very one of the best parts of my professional life to be associated with these individuals. Wow, that's quite a statement. It is June now. We are a long way away from flu season, but it will come. And that's when people usually turn to their doctors for advice about the flu shot and immunizations. Will what has happened with this advisory committee, will that impact public health come flu season time? I mean, are you worried about what we're going to see near the end of the year?
Well, we're right in the middle of a tenuous situation now, because at the June meeting each year, the advisory committee makes recommendations about influenza vaccine and also makes parallel recommendations for the last several years about COVID vaccines that ought to be used every fall. So this was a critical meeting. Those votes were looked to. And as I said, in our country, insurance companies would key on those recommendations and then pay appropriately for those vaccines to be delivered.
Dr. Schaffner, before we run out of time, I just wanted to say, from where we are sitting, looking at this story from the outside, the removal of the entire CDC Advisory Committee on Immunization Practices, that looks like a possible attack on science itself. Is that what we're witnessing?
I hope not, Brent. I hope not. I hope we're not witnessing that. But I can tell you, in the 61 years that this committee has been functioning excellently, nothing like this has ever happened. Everything will depend on who the people are who reconstitute the committee. Will they have professional respect? Will they be ethical? Will they base their recommendations on genuine debate and good science, devoted to the best population health for the United States? We're all looking forward to that, and we have our fingers crossed, as we say.
Yeah, we'll keep our fingers crossed for sure. Dr. William Schaffner. Dr. Schaffner, we appreciate your time and your valuable insights as always. Thank you.
My pleasure.